So we'll move on to the next session. Dr. Ferrer is one of our palliative care physicians who supports us, the patients, and their families in the time of distress, duress, and she's apt to talk about this session of how to deal with the symptoms. Dr. Ferrer, then she'll introduce the panel to come up, and then we'll have the second session.
Thank you, Dr. Bhimaraj, for inviting me here. So I am not a cardiologist. Dr. Bhimaraj says I am a palliative care physician, and we serve to support the heart failure team and provide their patients with additional support and the families as well. Up next on our agenda is a video with our patients talking about the next segment that we're going to emphasize about living with heart failure.
Perseverance. I just power through. It was definitely harder in the beginning because you're just adjusting to having children. And then there was a lot of fatigue, a lot of, I can't do this, I'm not gonna make it. We live in a 2-story home, so stairs still can be a challenge. I'm not supposed to carry the girls, much less upstairs, but don't tell Dr. Park that I do. But I would do anything for my girls. So I do it with heart failure.
I think the biggest challenge that I have, well, there are a couple of challenges, but I think the biggest one is really getting individuals around me who don't know about my diagnosis to understand what heart failure is. And for them to be able to understand that not all heart disease is necessarily due to lifestyle factors. I think a lot of people assign a certain degree of responsibility to individuals, assuming that they do certain things and you have this certain outcome. And in many cases, that's true. But for me, I didn't have the traditional risk factors like diabetes, high blood pressure, etc., that would have led to that. So basically, it became the story that I had to tell of this disease that just sort of appeared, and being able to get people to understand that the need to still get themselves checked and be able to have important follow-ups at certain points, because it can pretty much happen to anyone. And so I think that was a big challenge. But then also from a more personal standpoint, I think just recognizing the fact that I have to sort of temper some of my goals a little bit from a physical fitness or athletic standpoint, to realize that now the training now is more about health and not training to compete anymore.
I don't live to the disease. I really don't. I live to what I want to do. And what my focus is to get me the best that I can do and do the best I can do and have fun while I'm doing it. And that's all I can do. I don't believe in the woe is me, and I don't want people feeling sorry for me. In fact, my team doesn't even know I have the level of heart failure that I do. And I keep it that way because people look at you a little like, oh, I feel sorry for you, because it's, overtly, it's not showing. I don't have an oxygen tank with me, and they're not seeing me do things during the middle of the day. So I'm sort of a different patient.
I try to remind myself that enjoy the day, enjoy it. Don't always look at all the negative stuff and get all upset about the little small stuff. Just try to do the best you can to enjoy yourself, and that's really what it boils down to. And I think that's something that really everybody should strive to do. I think we get caught in all the minutia, the negativity and stuff like that. There's a lot of great things happening all around you. You just got to look at it, change your mindset. And that's what it boils down to, just sort of change how I look at things. And don't get me wrong, it's still a struggle in some cases. But when things are not going the way you want to, you have to ask yourself, well, there has to be a reason behind it.
I know intellectually I'm a heart failure person. I know that, but I guess in my childlike mind, maybe, I feel energetic, I want to do things, I've been snorkeling, I travel, I still work full-time, I fly full-time basically, and so for me, and I know everybody is different, for me, I've been able to continue to do the things that I want to do.
You know, they say moms of toddlers are tired, and I'm thinking, you don't know tired until you have heart failure. Right now, I'm able to, I feel like for the most part, keep up with them. I worry about when they get older and more active, I won't be able to keep up with them, and that worries me. You know, just riding our bikes around the neighborhood or going for a hike. I worry that I won't be able to keep up.
I don't really see it as a challenge, except, and I think the team will tell you that when I do have the echo done every 3 months, and I have it, and I always have this trepidation about what those numbers are. But I've come to learn that the numbers aren't the end-all be-all. So if my ejection fraction was, say, 28 or 29 this time, and it jumps up to 40, and then it's back down to 33, personally, I was freaking when that happened, but when Dr. Trachtenberg explained it, it made it all better. So the challenge for me is to remain calm when I get those numbers, because the numbers aren't the end all be all. It's how you feel. It's on your day-to-day basis, what you're doing, you know. And I feel alive. I feel like everybody else without heart failure.
That video kind of hits you right here. And I saw that for the first time yesterday, and I'm pretty emotional. And so my next presentation is about symptom management. This is I'm sorry, it looks like the date wasn't updated, but this is a presentation that was given last year at the first heart failure. And I just kind of want to give another plug and a reminder that there is a link that was sent out at the very beginning when you registered of the videos that are on YouTube. And so those videos from last year's conference are definitely available. And I'm just going to flip through some of these slides really quickly, because we want to make sure that we try to have enough time for questions. But again, we're the supportive and palliative care, trying to provide support for the patient and family. And I just kind of want to bring up this slide. It's been brought up quite a few times about the common symptoms of heart failure. And I put it up there just to identify it again. And the purpose of this presentation is not to necessarily go in depth with each symptom and tell you exactly what the medications are that we use to treat it, nor do we want to give dosages or anything like that. We just kind of want to be able to give you a brief understanding of what the general symptoms are and how we might suggest that you cope with them, not necessarily medication focused, because as we understand, everybody is different, and it's good to have these specific conversations with your doctor who knows your history and what other comorbidities you may be experiencing that affect the treatment of choice. One of the things that I think is key, and this conference focuses a lot on empowering you all to take part, a big part of your health care and approaching this disease process and trying to make sure that you get the best care as possible, is one, to keep a log. I encourage y'all to keep a log of your symptoms, as well as the timing and then the rating, 0 to 10. In between doctor's visits, a lot may happen, and for you to be able to recall off the top of your head when you're in front of the doctor experiencing white coat syndrome, your blood pressure's up, you're stressed because you had to find parking, you might not be able to give your doctor the whole story or your team the whole story. And so keeping a log of your symptoms and the timing and the circumstances surrounding those particular symptoms can help give your team a better picture of what's going on. But also, I think it will also help you understand what might be triggers for certain symptoms. For example, the weight gain may happen every time you have that Sunday brunch with the family at the Marriott breakfast buffet. it's just kind of one of those things that I think helps bring attention to what might be going on in your life that's just tough to recall later on. A lot of the emotional pieces that we've talked about too, the fear, anger, insomnia, anorexia, anxiety. I do want to reiterate what the panel had said earlier, that when you go through this after the diagnosis or after a procedure, the answer is not necessarily always a pill. I think we automatically jump to depression because we know there's a pill for depression, but there's also something just called grief and just coping with that news, dealing with the bad news that you just received. Sometimes that's just a matter of time and being able to process that event and not necessarily needing a pill. And so a lot of what what I'm trying to emphasize here is just maybe some of the things that may be able to help you deal with that diagnoses. Understanding the disease, we're trying to get you all to give you information so that you understand this disease process more. And all of you who have chosen to come here today have actually taken the proactive stance in trying to educate yourselves. A big thing that we want to encourage is to know who your support system is. Sometimes we think it is just our family, and it may not necessarily be limited to family. You've got church members, you've got team members, you can reach out to support networks, other patients and families who are dealing with heart failure. Ask questions, ask questions, ask questions. Know who to turn to for help. Identify who those key members are in your team, because again, it might not necessarily be your physician. It could be that front desk clerk who can help get you into that appointment, make your life that much more easier, accommodate your schedule. It can be the social worker who can help you reach out to take advantage of the community resources that might make transportation back and forth to the doctor's office that much easier. Knowing that you're not alone, I think coming to this conference can help you see that there are a lot more others who are traveling the same journey with you, and that can help alleviate some of that feeling of isolation that may make coping with this disease that much more difficult. And so having that support system, identifying that you're not alone, I think will help. Another thing that I want to emphasize too is the expectation piece, understanding your medical team's expectations. You know, we expect you to take your medications, expect you to make your appointments, but I also think it's important that you tell your medical team what your expectations are, whether you expect somebody to be available 24/7 whenever you call, whenever you might expect appointments to be available on the weekends or after hours. Also, communicate your limitations as well. We can write the prescription for this intervention, that medication, but if you're not open about the fact that maybe you can't afford the medication, or your transportation is limited, or maybe you just can't hear instructions clearly and we need to be able to accommodate that, that may be something that we can easily help. But if you don't let us know what your expectations and limitations are, it makes that interaction that much more difficult. You're going to be receiving some presentations in the upcoming segments on how to deal with stress, and so I'm not going to go into that too more. I'm going to introduce this phrase that I hear. I didn't come up with this, but I thought it was very important that we understand that sometimes there has to be an understanding that you might be facing what we call a new normal. With this diagnosis comes a lot of changes, and expecting yourself to go backwards in that, I think when we're talking about the stages of heart failure and being able to go back to baseline may not be realistic. It may be setting you up for frustration. And so I think a conversation and exploring what your new normal is may be worth having, and setting up goals based on that new normal. The last thing I want to leave you with is a question that I feel like we need to ask ourselves more often is, what is it that makes us happy? I think we can take this process, the heart failure process, and identify numbers and ejection fractions and blood pressure numbers as to be our target. But those numbers, again, to reiterate what one of the patients has said in the videos, may not mean anything if you're not accomplishing what it is that makes you happy. And so whether it be going on trips, scuba diving, running 2 miles, playing with your kids, just having a barbecue. I think you need to give yourself permission to define what is it that makes you happy and have that be a goal.